Alrighty, it looks like we are recording. So, hey everybody, welcome to my presentation. I wish that I could see you right now, but I'm really excited to present my topic today on photodynamic therapy. I first heard about this topic, about a year ago. I was taking a physics class, just physics 2, and my professor actually did research on a photosensitive drug, and he told us a lot about it in class, and I really had a good relationship with that professor as well, and he was able to start my interest in this topic. And so when I started taking biology student seminar, I decided that this would be a really great topic for me to focus on. I'm going to be dual recording this, and so I'm recording obviously the screen on my computer, and I was having some trouble also recording my face on my computer, so I'm recording it on my phone, and hopefully I'll be able to add it as like a little segment in the bottom right or left corner later to this presentation. If not, then you won't see it, and if you do, then please don't be too distracted by my face darting back and forth between my notes that I have and the screen that I have. But like I said, I'm really excited. I'm going to be talking about photodynamic therapy today. My name is Jacob Douglas Prescott IV, and let's start. So just right off the bat, I guess this is an average way to start a presentation, is usually with a statistic, but let's start off by talking about cancer. Cancer is the second leading cause of death in the United States. It led to the cause of death of 602,350 individuals in 2020 alone. I'm sure we've all been affected either by this, or we know somebody very personally and who's been affected by cancer. It's a really horrible disease, can be very detrimental, and can cause a lot of pain not only to the individual but the support group that individual has as well. And obviously we as human beings are really concerned with helping individuals with cancer. Medical professionals, other researchers, we want to know how to treat this disease. And so treatments for cancer are diverse. These are some of the big three common ones that I feel like we've all heard about and hear about all the time. I mean, up here on the left, we have radiation therapy. Obviously, radiation therapy can do what it can. These these photons and other things can be directed towards cancer to try and obliterate these cancer cells and cancerous tissues. We have surgery. That's a really common method, and obviously that just involves opening up the body and going and finding and localizing where the cancer is and removing it from the body. You obviously have chemotherapy. Chemotherapy is an interesting one that I'm sure we're all familiar with. Basically, these drugs, a toxic drug is administered to somebody, and because the drug is toxic, we hope that cancer cells, because they divide very rapidly and can grow very rapidly, we hope that the chemotherapeutic drugs that we administer to people will have a more adverse effect on the tumors and the growth of the tumors instead of the other healthy cells in the person's body. But of course, we all know these common treatments, and we all know that they can often lead to major and often very painful side effects. Obviously, with radiation therapy and chemotherapy, you're damaging healthy cells in the body that we're hoping don't get damaged, right? And so there are lots of side effects, just weakness, lethargy, and sometimes potentially there can be some really detrimental side effects from radiation and from chemo, where you lose function if it's damaged one sort of tissue or organ extensively, and of course, depending on the size of the cancer, of the tumor, then you can lose function already. So it's kind of a delicate balance that you have to play, possibly between radiation therapy, chemotherapy, and surgery. Obviously, surgery has its risks as well, not just the surgery itself, but anesthesia as usual, and just the recovery, and depending on how, again, how large the tumor is, to remove that from the body, it can have some side effects that are not fun to live with. And so this is where we can get into, I guess, my thesis. I'm going to tell you what my thesis is that I was exploring in this class, and then I'll explain what photodynamic therapy is. So photodynamic therapy, abbreviated PDT, selectively kills cancer cells while protecting healthy somatic and germ cells in the body. So research that's being poured into how can we more effectively treat cancer is just going back here. We want to be able to have these effects kind of like chemotherapy or radiation therapy, where we can go in and destroy cancer cells, but we want to protect the healthy cells in the rest of the body. And that's exactly what I'm exploring here. PDT selectively kills cancer cells while protecting healthy somatic and germ cells within the body. So now let me explain what photodynamic therapy is, and then I'll take you through the process of how it's shown to be effective and the current research that's being done to show the ways that it can really be effective in treating cancer, preventing cancer growth, things of that nature. Okay, let me get caught up with my notes right here. Okay. So, what is photodynamic therapy? Photodynamic therapy is a relatively new mode of cancer treatment that is promised for combating growth while minimizing the side effects of treatment. So that's kind of what I said when I went back a few slides ago. I'll read you what's on this slide real fast, and some things from my notes as well. PDT technology relies on a class of anti-cancer drugs called photosensitizers that become active when exposed to specific light wavelengths. So essentially, a drug can be given to somebody. It can be given sometimes topically, so on your skin. It can be given orally, as we would take drugs just normally, you and I, on a day-to-day basis. It can also be given intravenously. And after the drug is taken, after a certain allotted time, sometimes hours, sometimes a whole day, 24 hours, that drug can localize to the tumor area. So it becomes actually more concentrated in cancer tissue than it does other tissue. It localizes to the whole body, but concentrated in cancer tissue specifically. And after it is localized to the tumor area, a certain wavelength of light that drug, that chemical is sensitive to. So a wavelength emitting device can induce a conformational change on the drug, a conformational change, or it could break down the drug into a reactive form. Next point, this chemical change creates a highly reactive species, and it induces necrosis, apoptosis, and other forms of cell death. And when the drug localizes to tissue away from the wavelength that's being directed at the specified area, it adopts a non-toxic form. And it can be metabolized in other tissue, somatic, germ tissue, just fine in the rest of the body. And this is the whole idea behind photodynamic therapy. I feel like I had a thought that I was going to share, and I'm not seeing anything on my notes. But let's look at. So this is an example, of course, of a surgeon performing photodynamic therapy on a patient. It doesn't specify, this picture that I got from Wikimedia Commons, what type of cancer this person had, but they had received a dose of a photosensitive drug, and Obviously, they're shining a red wavelength of light on this drug, and it changes that chemical into its active state. And so when it's in that active state under that light, it creates that reactive species that can kill the cancer. And obviously, the rest of the drug floats around, not in that conformation because it's not exposed to that certain light. And this is how it works. I felt like it would be important. I apologize if I say I'm going to work on that for the rest of this video. But these are common chemical structures of photosensitive drugs in use. I won't attempt to necessarily pronounce every single one, but these are the common chemical structures of photosensitive drugs in use. This isn't an exhaustive list by any means. This first one on the top left over here, you can obviously see it's relatively large compared to the other three. This one is sort of an intermediate size. These two, I wanted to include these to show you all the obvious chemical difference in some of these drugs that are already being used in clinical trials and other things. Not clinical trials. These are ones that are being used today. The rest, I'll show you some photosensitive drugs that are being used in clinical trials. But you can see that all of these will have slightly different chemical effects in the body and localize possibly to different parts of the cell. And that's just important to realize that there are different types of drugs, different photosensitive chemicals out there that can localize to different parts of the tissue more specifically and combat cancer in slightly different ways. And these are some common chemical structures of photosensitive drugs in clinical trials. Again, this list isn't exhaustive, but I chose these images and the images in the slide before to give you a sense, to give you an idea of what they look like, at least in their non-active state, so that you can have an idea of, oh, these can serve a different function within the cell. Exploring new ways to utilize photodynamic therapy. So photodynamic therapy was already being used up until very recently in things like skin cancer, esophageal cancer, sometimes bladder carcinomas, and those things, like skin cancer, obviously is very topical. It's not very deep in a patient's body. And so what I was researching more specifically was how can photodynamic therapy be effective, especially in these deeper tissues. And one of the first examples that I came up with, and which I wrote about extensively in my paper, was prostate cancer. Obviously, this is more deep than just your skin. And you can see from this resource that I also have listed at the end of my slides and at the end of this presentation, essentially what happens and what most of the research into using photodynamic therapy for prostate cancer, how this works for prostate cancer, I should say, is the photosensitive drug is given intravenously. Usually the patient has to wait about 24 hours for the photosensitive drug to localize specifically on the tumor, in this case the prostate cancer, and it obviously gets distributed through other parts of the body as well. And then there are some smaller surgical incisions that are made in these optic fibers, and an ultrasound probe are directed towards the prostate, and they can find, especially with the ultrasound probe, where the tumor is growing and direct those optic fibers into those cancerous cells in the prostate, and then they can activate it. And from this research that's cited here specifically, they found that this is such a beneficial way to treat cancer, photodynamic therapy, especially for prostate cancer, because the options, like I mentioned at the beginning of this presentation, can be risky for prostate cancer. If you have to go in and surgically remove some of the prostate, that can lead to some detrimental sexual function, urinary function, and things of that nature that are just not enjoyable and really affect people's standards of living. And photodynamic therapy has the benefit of potentially it can either shrink the tumor down to a much smaller size so that it can be more easily removed from surgery, and those effects can be pretty much avoided or lessened to a greater extent, or it can induce apoptosis, other forms of cell death in the cancer cells, and so the cancer can be moved, into remission, and they can preserve and not have to take any of the prostate out in the process, which is great for these patients. Some of the other research that I was exploring in this class involved portable photodynamic therapy medical devices, as this slide says. This comes really in handy, especially for developing countries and rural communities. It can be difficult sometimes for people to get away for long enough, or feel the need sometimes to even travel hours or days or weeks to get photodynamic therapy that can benefit them. This study that I have cited here was specifically about cancers of like the mouth and potentially the throat, and building a portable device that people can take home with them so they can get a prescription, a drug that they can take just at their house, in their home, and that it's a photosensitive drug. It will localize to the tumor area, and there's a box that is a wavelength emitting device, and it has a key and a button that you need to press and some intricate details. But when you activate this, it can activate this certain type of wavelength that the photosensitive drug is sensitive to, and you can hold it to, like is shown in this picture here, to if it was in the cheek or the jaw or something like that, and the laser can induce a conformational change in the drug, create those reactive species, and ablate the cancer tissue and kill the cancer tissue. This was a really interesting study for me to come across. There are some improvements that they need to make, especially with the device itself, just to make it tamper-proof and things of that nature. But the researchers who wrote this article were really encouraged with the device that they had made, and they feel like we are really close, so to speak, to building a portable device that people can take home with them and receive treatment at home, with some other cautions and medical advice that I'll get to here in a minute. This is taking a while, so I guess I better get through this. New PDT effects combined with immunotherapy. So photodynamic therapy, it works really well with immunotherapy, especially to induce pyroptosis, which is an immune system induced form of cell death. So using immunotherapy and photodynamic therapy together, I'll show you in a few slides here, but photodynamic therapy already does a great job at actually inducing some immunotherapy, and it does a great job at treating cancer immediately and improving the immune response toward cancer cells in patients after treatment. Combined with photothermal therapy, so kind of a similar idea to photodynamic therapy. PTT converts light energy into heat energy. The combined effects of PDT and PDT are remarkable. Obviously, this is not a quote from, but this is pulled from some research I have cited down here. The remarkable PTT can improve blood flow to the area, which can cause increase in oxygen concentration in tumor tissue, and the reactive oxygen species generated from PDT then have an exacerbated effect, stimulating damage in the heat shock to tumor proteins. PDT has also been shown in this case to actually induce immunotherapy, and it induces cytotoxic lymphocytes to exert a sustained anti-tumor effect. It boosts the immune response later too, and so these were some great effects. And this study I've listed here, this specific photosensitive drug is found to strongly induce pyroptosis, and also has a mitochondria anchoring ability, which is this ability it has to basically lock the mitochondria in place in cancer cells, which is really useful in this mode of treatment. So essentially, some of the best effects from PDT are and combined treatments promote immune function, and that's what I found was one of the greatest benefits of PDT, and that I'm talking about in my research paper right now, is that it boosts immune function, which is great because traditional routes, chemotherapy, radiation, don't necessarily boost immune function. Sometimes they can suppress it, and so if we can boost it while treating cancer itself, that's the way to go, right? What could improve? The number one caveat to PDT is the fact that if you take this drug, you have to wait at least 6 weeks before you can go outside into the sunlight again, right? Because this drug is localized to tissue all around your body, and so you yourself and your cells are going to be very sensitive to light, and so that's a big hindrance, and sometimes that's really hard for people to follow. And of course, you need to be careful with light in your house and things like that as well. Darkness is my only friend. Improvements. Some of the cited improvements also allude to, how do these dissolve in the rest of your tissues over time, and this form of treatment is dependent on how much irradiation the drug is exposed to, and sometimes it doesn't get enough. There have been significant improvements in PDT that have treated cancer, but this is still something that wants to be improved and wants to see improvement. One of the main improvements, so to speak, progressed PDT and related research comes from somewhat outside the scientific community. The main hindrance to PDT is government body approvals, and that's not necessarily a bad thing. Sometimes those things take time, right? But that does hold some of the research back sometimes, especially when it comes to applying these things to clinical trials. So what I found through my research is that photodynamic therapy is and will continue to be an effective treatment for cancer. Here are my references. This was really exciting. I hope you all liked it. I apologize for going 2 minutes over.